Hi everyone, welcome to researchmd.com. My name is Dr. Pramil. I work as a Chief Medical Officer and an Associate Professor of Medicine, one of the large medical schools in the United States. So let's start our presentation. We've been doing a series of lectures on the herbal medications and its complications. And again, I wanted to make sure, the whole purpose of this talk is not about the herbal medication, the tremendous benefits or beneficial effects of herbal medicine, but we have to be aware of its complications also. Once we are aware of the complications, we can stop it. Okay, like every drug, when you talk about the herbal medicine, especially people call it like a natural or like a food supplement, right? That's the way they sell it. So the main purpose we want the public to be aware of what complications you can expect when you take some of the herbal medicines. Okay, so we're going to start with this drug called Ephedra, which probably when we looked at it, it has more complication any other herbal medication in the world. Okay, so be careful when you see any product with a component or ingredient Ephedra. You have to be very careful because the complications are like extremely high. Okay, so let's go back to the history of Ephedra. Mainly when you talk about the herbal medication, where do they usually come from? China, India, those Asian countries. Okay, just like that. It's very popular in India and China. Usually they take for like upper respiratory infections and all that. In China, it's actually called Ma Hong. That is the other name they use it in China. When we talk about the ephedrine, let's look at what are the components or chemistry behind it. Okay, it's mainly an alkaloid. You got ephedrine. The other components like pseudoephedrine, nor pseudoephedrine. Okay, those are the main component in the drug in the herbal medication ephedrine. Okay, when you talk about again ephedrine, what's the number one? The reason people usually lose it, again, what is people worried about? What is everybody wanted to do? They wanted to lose weight, right? That's why they take this drug. So the main use in the United States is mainly about weight loss. Okay, it can also, athletes were using it as a stimulant, but it also has some good properties against some infection, especially anti-pseudomonal infection and fungal infections also. Okay, so when we talk about, the first thing, we did a lot of literature search. Again, all our presentations are scientific based. So we did like extensive scientific literature search, and let's see what we found. Okay, ephedrine, the first study looked at the ephedrine's cardiovascular and the CNS effect. That means like neurovascular. When you talk about this, in this study, what they found out is a large number of people have like psychosis, seizure, stroke, high blood pressure, subarachnoid hemorrhage, that means like bleeding in the brain. Vasospasm, that means your coronary artery becomes so small, myocardial infarction, and those are the main complications they found in this first study. When we let's look at the other study. When in this study they look at, they look at the ephedra and the psychiatric complications, which are like psychosis, and then it can be like mainly it can cause like homicidal tendencies and suicidal tendencies, dizziness, mania, rage, anything you name, any psychiatric complication, ephedra can cause it. Okay, let's look at the next study, and then just kind of looked at, this is probably like one of the best warning studies of ephedra. What did they find out in this study is very scary. Almost like 54 people died because they were using ephedra in this study. Myocardial infarction is the second. Then you got stroke, and then you got seizure, and then psychosis. Those are the main things they found in this study. Okay, let's look at the other study they looked at. It's a meta-analysis. When you talk about meta-analysis, they pooled a lot of studies and a lot of information comes from. Let's see what they found. In this study, they found psychosis. They got palpitations, hypertension, gastrointestinal symptoms, headache, and autonomic hyperactivity, anything kind of palpitation, like those are the symptoms when you talk about autonomic hyperactivity. Okay, now let's look at then we looked at some of the case reports. When we talk about case reports, can always bring you a lot of information the other people don't have. It may be rare, but you have to be worrying about it. Okay, so in this 39-year-old was like a bodybuilder. He came with a headache, blurriness of the vision. Then he had like hemianopsia, that means he cannot see some part of the eye, and he had hypertension, he got tachycardia, and he also developed two-stroke, and then he also cardiomyopathy. That means his heart was enlarged. Okay, let's look at the next case report. A 36-year-old patient, they took it and they developed cardiomyopathy. That means again your heart kind of act like a balloon and it's kind of developed it expand. Okay, now let's look at the next case study. A 28-year-old, again all the same patient, came with a myocardial infarction after taking this drug. And we talked about the cardiovascular complications, right? It can definitely cause myocardial infarction or heart attack. Now, the next study, again, it's a case report, and this is a 77-year-old and came in. So, I mean, he was taking Ephedra. He came ventricular tachycardia. That means, you know, the heart rate arrhythmia heart start beating so fast and usually kind of stands still and kind of cardiac arrest. Okay, let's look at the next case report. A 68-year-old person came in. He developed intracerebral hemorrhage, and then you also have like vasculitis. That means inflammation of the vessels in the CNS system. Next case report we looked at is a 40-year-old. He came with, a very unusual complication, never been reported anywhere. He started having bloody diarrhea, and he developed ischemic colitis. That means blood supply into your stomach has been cut off. When it happens, what happens is like if there is no blood supply, not enough oxygen, nutrient, and the tissues is going to die, and part of the stomach can die, and it could develop into death. Okay. Now, next case report is an unusual case report. This patient taking ephedrine, I think they mixed it with the cocaine, and they would develop priapism. That means enlarged erection of the penis. So it's noted in this case study. Next case report is about a 36-year-old patient start taking ephedra and he got aortic dissection. Aorta is one of the largest vessels in the body carrying the blood, correct? And there's like a rupture of the aorta in this patient. That's what happened. Next patient. We looked at it. They were about the patient taking ephedrine. Just like we talk about the cardiovascular, he developed cardiomyopathy. That means his heart was become very large, like a balloon, and they cannot pump as usual. Okay, so let's look at the next study. Again, it's very unusual. Another complication reported after taking ephedrine, and that is rupture of the liver. He got the liver was a huge organ in the body and ruptured after taking this medication. Again, ephedrine, be careful when you take a medicine. Many complications. You could die. You can have you can have stroke. You can have a heart attack. You can have seizure. You can have like psychiatric symptoms, including like homicidal tendencies and suicidal tendencies. Okay, so many drugs, even though it's banned in the United States, when you take a herbal medicine, just make sure the company don't add ephedrine in this product. But many part of the world is still not banned, so just be careful. Thank you so much for watching our presentation. Greatly appreciate you if you could subscribe to our channel, because it takes a lot of effort to make videos like that, to make aware of the complications some of the drug. And we want to continue that. For that, we need your support. Okay, again, thank you for watching. Please subscribe to our channel so we can continue our journey together. God bless. Thank you.